Attention Deficit Hyperactivity Disorder, simply referred to as ADHD, is a neurodevelopmental condition first described by Dr. George Still in 1902. He was able to recognize a set of behaviors in children that included inattention, impulsivity, and hyperactivity, and over time, our understanding of ADHD would only continue to grow. A primary symptom of this disorder is having trouble paying attention, which leads to forgetfulness and being disorganized. Another symptom is the hyperactive side of it, which causes restlessness, fidgeting, and doing impulsive things. Some individuals may only experience the inattentive symptoms, while others mostly the hyperactive side of it, and in many cases, people who have ADHD exhibit a combination of both. This disorder stems from differences in brain structure and functioning, with genetic factors playing a significant role, as it tends to run in families. In the United States, around 5 to 10% of children and 2 to 5% of adults are estimated to have ADHD, and it is diagnosed based on a persistent pattern of symptoms that interfere with functioning across multiple settings, such as at work, school, and home. In the past, ADHD was often misunderstood, and terms like minimal brain dysfunction were used, with treatment being limited. By the mid-20th century, stimulant medications like Ritalin were discovered to help manage symptoms by increasing dopamine levels in the brain. Today, ADHD is treated with a combination of behavioral therapy and medications, but despite better understanding, ADHD is still sometimes misdiagnosed or dismissed, specifically in adults and girls, due to many people presenting symptoms differently. Increased awareness and research have improved outcomes, but the disorder continues to be a subject of social and scientific focus. Antisocial personality disorder, simply abbreviated to ASPD, is characterized by a pattern of disregard for the rights of others, impulsivity, and lack of remorse. It was first widely recognized in the early 19th century, evolving from concepts like moral insanity, a term used by psychiatrist Philippe Pinel. In the 20th century, it eventually gained the name that we know today. Symptoms of ASPD include persistent deceitfulness, irritability, aggressiveness, recklessness, and a failure to conform to social norms, such as violating laws. Individuals with ASPD often show little regard for safety, both for themselves and others, and frequently engage in manipulative or unlawful behavior without feeling guilt. Lack of empathy and difficulty maintaining long-term relationships or employment are also common, and ASPD is believed to arise from a combination of genetic predisposition and also environmental factors, such as childhood abuse or neglect. Around 1 to 4% of the population may have ASPD, with the higher prevalence among men and within prison populations. In the past, ASPD was poorly understood and often treated with harsh measures, including institutionalization. Today, treatments are more targeted, though managing ASPD remains challenging. Cognitive behavioral therapy is sometimes used to help individuals recognize and modify harmful behavior, though therapy is often met with resistance. There is no specific medication for ASPD, but mood stabilizers or antidepressants may be prescribed to address associated issues like irritability or aggression. Despite modern treatments, ASPD remains difficult to treat, as individuals with this disorder often do not seek help willingly. Anxiety disorders are a group of mental health conditions characterized by excessive fear, worry, and nervousness that interfere with daily life. The understanding of anxiety has evolved over centuries, but it wasn't until the 19th and 20th centuries that it began to be seen as a distinct psychological condition. Anxiety disorders include a range of conditions, with generalized anxiety disorder, abbreviated as GAD, and social anxiety disorder, also known as SAD, being two common forms. GAD involves chronic, uncontrollable worry about a wide range of life events, even when there is little or no cause for concern. Symptoms include restlessness, difficulty concentrating, irritability, muscle tension, and sleep problems, whereas SAD, on the other hand, involves an intense fear of social situations, where a person may fear being judged, humiliated, or embarrassed. While GAD affects a person's overall life, SAD is more situation-specific, focused more on interactions with others. Anxiety disorders are caused by a combination of genetic, biological, and environmental factors, and these disorders are widespread, affecting about 20% of the population, with women more likely to experience them than men. In the past, anxiety was often misunderstood and treated with crude methods like institutionalization or sedatives, but today, cognitive behavioral therapy, exposure therapy, and medications like SSRIs are common treatments. Mindfulness and lifestyle changes also play a role in managing anxiety, and these disorders are thankfully highly treatable, though many people go undiagnosed or untreated. With that being said, greater awareness in recent decades has led to better outcomes for those affected. Bipolar disorder is characterized by extreme mood swings between manic and depressive episodes. This disorder was first described in antiquity, with Greek physician Hippocrates documenting mood swings similar to mania and depression. However, it wasn't until the mid-19th century that French psychiatrists Jean-Pierre Fauret and Jules Ballarger distinguished these mood swings as distinct illnesses. illnesses, originally calling it circular insanity. In the 20th century, the term manic depressive illness was used before finally settling on bipolar disorder. There are two main types of this disorder, bipolar 1 and bipolar 2, with bipolar 1 involving more severe manic episodes, which may lead to risky behaviors, decreased need for sleep, inflated self-esteem, and racing thoughts. These manic periods are often followed by major depressive episodes, which includes feelings of hopelessness, fatigue, and suicidal thoughts. Bipolar 2 involves less severe mania, known as hypomania, but individuals still experience significant depressive episodes. Bipolar disorder affects about 1 to 3% of the population and is often diagnosed in late adolescence or early adulthood. The exact causes are unclear, but a combination of genetic predisposition, brain structure differences, and environmental stressors continue to its onset. Dysregulation in brain chemicals like dopamine and serotonin plays a role in the disorder's extreme mood fluctuations, and in the past, treatments for this disorder were limited and harsh, often involving institutionalization or ineffective sedatives. The discovery of lithium in the mid-20th century revolutionized treatment as it was able to stabilize mood swings. Today, mood stabilizers, antidepressants, and antipsychotics are commonly used, and psychotherapy is also effective in helping individuals manage symptoms and understand triggers. Although bipolar disorder is chronic, with proper treatment and management, many individuals have fulfilling lives. However, treatment adherence can be challenging due to the nature of the illness. Body dysmorphic disorder, otherwise known as BDD or body dysmorphia, is characterized by an obsessive focus on perceived flaws or defects in one's physical appearance, which are often minor or entirely unnoticeable to others. This disorder was first described in the late 19th century by Italian psychiatrist Enrico Morselli, who referred to it as dysmorphophobia. However, it wasn't until the late 20th century that it gained the name that we know today. Symptoms of BDD include excessive grooming, mirror checking, comparing one's appearance to others, and seeking reassurance about their perceived flaw. These behaviors can lead to significant distress and impaired daily functioning. The perceived defects often revolve around specific body parts, such as the skin, hair, nose, or stomach, but any part of the body can be the focus. Individuals with BDD may avoid social situations or resort to cosmetic procedures in an attempt to fix the perceived flaw. Brain studies have shown abnormalities in how individuals with BDD process visual information and emotions, specifically in regions like the prefrontal cortex. BDD affects approximately 1 to 2% of the population, with both men and women equally affected. It often begins in adolescence, a time when body image concerns are heightened, and in the past, this disorder was misunderstood and often dismissed as vanity or low self-esteem. Treatment options were limited, sometimes involving hospitalization or ineffective therapies. Today, BDD is treated with a combination of cognitive behavioral therapy and medications such as SSRIs. These treatments help reduce obsessive thoughts and compulsive behaviors. However, many individuals with BDD struggle to seek treatment due to feelings of shame or denial about the severity of the condition. Borderline personality disorder, simply known as BPD, is characterized by instability in emotions, self-image, behavior, and interpersonal thoughts. The term borderline was first introduced in the 1930s by psychoanalyst Adolf Stern, who described patients that seem to exist on the borderline between neurosis and psychosis. However, it wasn't until the late 20th century that BPD became more recognized as what it is today. The core symptoms of BPD include intense emotional instability, fear of abandonment, chronic feelings of emptiness, impulsive behaviors, and unstable relationships. People with this disorder often experience rapid mood swings and have difficulty managing intense emotions. Self-harm and suicidal thoughts are common in more severe cases, and identity disturbances, as well as difficulty establishing a consistent sense of self, are also major aspects of this condition. BPD is thought to arise from a combination of genetic vulnerability, childhood trauma, and environmental factors. Brain studies suggest that individuals with this disorder may have overactive emotional responses due to abnormalities in the amygdala, the brain's emotion regulation center, and reduced regulation from the prefrontal cortex. BPD affects about 1 to 2% of the population, with a higher prevalence among women. It is a chronic condition, but symptoms can improve over time with proper treatment. In the past, BPD was misunderstood, and patients were often labeled as manipulative or treatment resistant. Treatment was largely ineffective, and some individuals were institutionalized. Today, dialectical behavior therapy, developed by psychologist Marsha Linehan, is the most effective treatment for BPD. It focuses on emotional regulation, distress tolerance, and interpersonal skills. Medications such as mood stabilizers and antidepressants may also be used to manage symptoms, symptoms, though they do not treat the core disorder. Despite its challenging nature, many individuals with BPD experience significant improvement with the right treatment and support. Depersonalization derealization disorder, simply referred to as DDD, is a dissociative condition where individuals feel detached from their own body or experience the world as unreal or distorted. While these sensations can be infrequent for many, people with DDD experience them persistently, causing significant distress and impairing their ability to function. The concept of depersonalization dates back to the 19th century, with early discussions by philosophers and physicians. However, it wasn't until the mid-20th century that it was formally recognized. Symptoms of depersonalization include feeling as if one is observing themselves from outside their body or feeling emotionally numb. Derealization involves the perception that the world is dreamlike, foggy, or artificial. These episodes can be triggered by stress, trauma, or drug abuse, but in DDD, they occur persistently and without an external cause. It is estimated that around 1 to 2% of the general population may experience chronic depersonalization derealization disorder at some points. Those short and irregular episodes are much more common. This disorder is thought to stem from a combination of psychological and neurological functions, specifically involving disruptions in emotional processing and the brain's response to stress. Treatment typically involves psychotherapy, which helps individuals challenge distorted thinking patterns and develop coping strategies. Medications such as antidepressants or anti-anxiety drugs may be prescribed, though no specific medication is approved solely for DDD. In the past, treatment for dissociative disorders were often overlooked or misunderstood, with individuals sometimes misdiagnosed as having psychotic conditions. Today, with a better understanding and specialized therapeutic approaches, outcomes for those with DDD are improving. Depression, or major depressive disorder, is characterized by persistent feelings of sadness, hopelessness, and a lack of interest in daily activities. The concept of depression has existed for centuries, with ancient Greeks referring to it as melancholia, believing it to be caused by an imbalance of bodily humors. In the 19th century, depression became more recognized as a psychological condition, influenced by early psychiatry and the work of figures like Sigmund Freud. However, it wasn't until the 20th century that depression was fully understood as a complex mental illness. Symptoms of depression include prolonged periods of low mood, fatigue, sleep disturbances, difficulty concentrating, feelings of worthlessness or guilt, and in severe cases, suicidal thoughts. Depression can vary in severity and may occur as a single episode or as recurrent episodes throughout life. It is caused by a combination of biological, genetic, environmental, and psychological factors, and the brain's neurotransmitters, especially serotonin, dopamine, and norepinephrine, play a role in regulating mood. Dysregulation in these chemicals, along with abnormal activity in brain regions like the prefrontal cortex, contributes to the symptoms of depression. This disorder is widespread, affecting approximately 5 to 7% of adults globally each year, with women more likely to experience it than men. Historically, depression was treated with ineffective and often harsh methods, including bloodletting, isolation, and electroconvulsive therapy. In the mid-20th century, the development of antidepressant medications, such as tricyclics and SSRIs, revolutionized treatment. Today, depression is managed by a combination of medication, psychotherapy, and lifestyle changes, and with appropriate treatment, many individuals with depression achieve significant improvements in their symptoms and quality of life. Dissociative identity disorder, simply abbreviated to DID, and formerly known as multiple personality disorder, is characterized by the presence of 2 or more distinct personality states or identities within an individual. These identities often have their own names, memories, and characteristics, and can take control of the person's behavior at different times. This disorder was first formally recognized in the late 19th century, but it gained widespread attention in the 20th century with the famous case of Sybil, a woman diagnosed with 16 different personalities. DID typically arises as a result of severe, chronic trauma, most often during early childhood, such as physical, sexual, or emotional abuse. The condition is thought to develop as a coping mechanism where the mind disassociates from the trauma, creating separate identities to manage overwhelming experiences. Disassociation involves a disconnect between a person's thoughts, memories, feelings, and sense of identity. Symptoms of DID include memory gaps, blackouts, or amnesia for certain periods, shifts in behavior or personality, and difficulty with identity continuity. Individuals with this disorder may also experience other dissociative symptoms like depersonalization and derealization. DID is relatively rare, affecting approximately 1 to 2% of the population, though it is often misdiagnosed as other mental health conditions, such as borderline personality disorder or schizophrenia. In the past, DID was often misunderstood and sensationalized, with treatment typically being poor, involving institutionalization or ineffective therapies. Today, treatment focuses on trauma-informed therapy, specifically long-term psychotherapy. While no specific medications treat DID, antidepressants or anxiolytics may be used to help treat other symptoms that arise arise from this disorder. Although DID is a chronic condition, with proper treatment, many individuals can achieve a more stable sense of self and improved quality of life. Eating disorders are characterized by unhealthy relationships with food, body image, and weight, and these disorders were first recognized in medical literature in the late 19th century, with anorexia nervosa being described by British physician Sir William Gull in 1873. However, the understanding of eating disorders expanded significantly in the 20th century as more cases were identified and studied. There are three primary types of eating disorders, with the major one being anorexia nervosa, where individuals restrict food intake, often to the point of starvation, due to an intense fear of gaining weight and a distorted body image. Symptoms include extreme weight loss, obsessive calorie counting, and an unwillingness to maintain a healthy weight. Anorexia also has the highest mortality rate of any other mental illness. Another prominent eating disorder is bulimia nervosa, and this condition involves cycles of binge eating, followed by behaviors like vomiting, excessive exercise, or laxative abuse to prevent weight gain. Individuals often feel out of control during binges and experience intense guilt afterwards. Despite often being within a normal weight range, people with bulimia are deeply preoccupied with their body image. The last one is binge eating disorder, and it is characterized by regular episodes of consuming large quantities of food in a short period, often in secret, accompanied by feelings of shame or guilt, and this leads to weight gain and health issues. Eating disorders are complex, resulting from a combination of genetic, biological, psychological, and environmental factors. Cultural pressures, trauma, and family dynamics can trigger or worsen these conditions. Approximately 9% of the global population will experience an eating disorder in their lifetime, with women more frequently affected. Treatment often involves a multidisciplinary approach, including psychotherapy, nutritional counseling, and medical monitoring. In severe cases, hospitalization may be necessary to stabilize physical health. Historically, eating disorders were misunderstood, often seen as a self-control issue, but today, they are recognized as serious, life-threatening mental health conditions that require specialized care. With early intervention, many individuals can recover and regain a healthy relationship with food and their bodies. Narcissism, or narcissistic personality disorder, simply abbreviated to NPD, is characterized by an inflated sense of self-importance, a deep need for admiration, and a lack of empathy for others. The concept of narcissism originated from the ancient Greek myth of Narcissus, a young man who fell in love with his own reflection. In the modern era, psychoanalyst Sigmund Freud introduced the term in the early 20th century to describe self-obsession as part of human development. The symptoms of NPD include grandiosity, a constant need for attention and validation, fantasies of success or power, and a belief in one's superiority over others. Individuals with NPD often exhibit manipulative or exploitive behaviors in relationships as they expect special treatment but struggle to empathize with others. They are highly sensitive to criticism and may react with anger or defensiveness when their self-image is challenged. NPD is believed to arise from a combination of genetic factors, childhood experiences such as excessive pampering or neglect, and environmental influences. People with NPD often mask deep insecurities with outward displays of confidence or arrogance. This disorder affects about 1 to 2% of the population, with a higher prevalence in men. It can severely impact relationships, work, and social functioning, though many individuals with NPD may not seek treatment as they do not perceive their behavior as problematic. Historically, narcissism was often dismissed as arrogance rather than a mental health issue, and treatment for NPD remains challenging because most individuals are resistant to acknowledging their issues. Psychotherapy and psychodynamic therapy can help patients develop greater self-awareness, regulate emotions, and improve interpersonal skills. There are no specific medications for NPD, but treatment of co-occurring conditions like depression or anxiety may help. While NPD is difficult to treat, long-term therapy can give personal growth and improved relationships for individuals who engage with treatment. Obsessive compulsive disorder, simply referred to as OCD, is characterized by intrusive, unwanted thoughts and repetitive behaviors aimed at reducing anxiety caused by those thoughts. The understanding of OCD dates back to the Middle Ages, when individuals with obsessive thoughts were often believed to be possessed or under supernatural influence. In the 19th century, French psychiatrist Jean-Étienne Dominique Esquirol distinguished between madness and what would later be called OCD in the 20th century. Obsessions in OCD can range from fears of contamination, concerns about safety, or intrusive thoughts about harming others. To cope with these obsessions, individuals engage in compulsions, which are repetitive behaviors like excessive cleaning, checking, counting, or repeating phrases. These compulsions are intended to neutralize the anxiety, but often become distressing themselves as they consume large amounts of time and energy. OCD works by creating a cycle of anxiety, as the intrusive thoughts provoke distress, and the compulsive behaviors temporarily relieve that anxiety, reinforcing the behavior. However, the relief is short-lived, and the cycle only continues. OCD affects about 2 to 3% of the population, often starting in adolescence or early adulthood, and it affects men and women equally. Historically, OCD was misunderstood, with individuals individuals often seen as neurotic or overreactive. Early treatments included institutionalization, electroconvulsive therapy, but today, cognitive behavioral therapy, specifically a technique called exposure and response prevention, is the most effective treatment. SSRIs are also commonly used to help reduce symptoms by altering serotonin levels, and with proper treatment, many individuals with OCD can manage their symptoms and live fulfilling lives, though the condition may remain chronic for some. Paranoid personality disorder, simply abbreviated to PPD, is characterized by distrust and suspicion of others, often without any reason to believe that people are trying to harm them. PPD was first recognized as a mental health disorder in the early 20th century, though its symptoms had been documented earlier. People with PPD typically display patterns of suspiciousness, a belief that others are exploiting or deceiving them, reluctance to trust others, and a tendency to bear grudges. They often perceive innocent remarks as personal attacks and may react with anger or hostility. The exact cause of PPD remains unclear, though it is believed to arise from a combination of genetic, environmental, and psychological factors. It often manifests in adulthood, and it is more common in men than women. Approximately 2 to 4% of the general population may have PPD, though many cases may go undiagnosed due to the reluctance of individuals to seek treatments. Treatment of PPD usually involves psychotherapy, which helps individuals identify and challenge their mistrust and negative thought patterns. Medication may be prescribed for anxiety or depression, but these are not primary treatments for PPD itself. In the past, treatments were more rudimentary and often included hospitalization, but this rarely occurs today. Understanding and managing PPD can be challenging due to the individual's intense distrust, but therapy can help improve relationships and overall functioning. Post-traumatic stress disorder, which is also known as PTSD, is a condition that develops after exposure to a traumatic event such as war, assault, natural disasters, or serious accidents. Individuals with PTSD experience intrusive memories, flashbacks, nightmares, and severe anxiety related to the trauma. They may also avoid places, people, or activities that remind them of the events and may feel emotionally numb or detached. PTSD was first formally recognized in the 1980s. However, the concept of trauma-related psychological distress has been noted for centuries, often referred to as shell shock or combat fatigue during World War I and II. Earlier descriptions of similar symptoms also appeared in literature, with terms like soldier's heart and battle fatigue. PTSD affects about 6 to 7% of people at some point in their lives, although certain groups, such as military veterans and survivors of abuse, have much higher rates. The disorder arises when the brain's fear processing system becomes hypersensitive, causing heightened response to stress even long after the traumatic event has passed. The amygdala becomes overactive, while the prefrontal cortex becomes underactive, impairing the brain's ability to manage fear responses. Treatment for PTSD often involves psychotherapy and eye movement, desensitization, and reprocessing, which helps people reprocess traumatic memories. Medications like SSRIs are also prescribed to manage anxiety and depression symptoms. In the past, people with PTSD were often misunderstood or stigmatized, and treatments were largely ineffective. Today, there's a greater awareness of this disorder, and early intervention and evidence-based treatments have led to better outcomes for many individuals. Schizophrenia is a chronic, severe mental disorder that affects how a person thinks, feels, and behaves. It often leads to distortions in reality, such as hallucinations, delusions, and disorganized thinking. People with this disorder may also have difficulty with speech, lack of motivation, and emotional flatness. The concept of schizophrenia has been evolving for centuries, but it was formally identified in the early 20th century by Swiss psychiatrist Eugen Bleuler, who coined the term in 1911. Before this, it was originally known as dementia praecox in the late 1800s, describing it as a distinct disorder characterized by early onset psychosis. Schizophrenia is now understood as a spectrum disorder with a wide variety of symptoms that vary in severity. It affects about 1% of the global population and typically emerges in late adolescence or early adulthood. The exact cause is unknown, but it is believed to result from a combination of genetic, biochemical, and environmental factors. Neuroimaging studies suggest abnormalities in brain structure and function, specifically in the dopamine system, which regulates mood and perception. Treatment for schizophrenia usually involves a combination of antipsychotic medications to manage symptoms and psychotherapy to support coping skills and social functioning. Cognitive behavioral therapy and family therapy are commonly used to help patients manage their condition. Medications, specifically second-grade antipsychotics, target dopamine receptors and reduce hallucinations and delusions. In the past, schizophrenia was poorly understood and treated inhumanely, with methods like institutionalization, electroconvulsive therapy, and even lobotomies. Patients were often stigmatized and socially isolated, but today, with advances in medicine and therapy, there's a better understanding of schizophrenia as a manageable condition, and many individuals with this disorder can lead fulfilling lives with proper treatment and support. Thank you very much for watching this video, and if you learned something, make sure to leave a like, comment down below your thoughts, and subscribe if you would like to see more videos like this one. Thank you again, and goodbye.